Right, so these are COVID times. And misinformation has been deemed public health crisis. It's been deemed illegal, in at least one state, probably more. And certainly has been, at the forefront of controlling information when it comes to social media. So, what's the concern about misinformation? There's an altruistic concern in terms of saving lives, keeping people healthy. But then there's, when it comes to science, and you're talking about misinformation, you're essentially taking the science, taking the process of investigation away from it. So now you've made it so it's not a scientific process. Now you've made it an ideology. So for example, when I was in grade school, we were taught hot water freezes faster. This is what the science teacher taught. It was like, oh, whoa, it's such a mystery. Hot water freezes faster. Yeah, there were studies. They did studies, multiple studies, and they showed, like, put cold water in the freezer, takes this long to freeze. Take hot water, put it in the freezer, it freezes faster. Hot water freezes faster. Okay, so that's what the science teachers are teaching. And imagine where you have no ability to replicate that study. This is what you're being taught. This is what the science teachers, the authorities are telling you. This is what you have to believe because the authorities are telling you this, and you don't have the means to replicate the study, right? You just don't have the necessary materials. But if you do have the necessary materials, and it's not deemed misinformation to question, and you do the study and you see, oh, wait, why did the hot water freeze faster? Oh, because it turned on the compressor, because the fan kicked on and it was blowing on the hot water. That's why the hot water froze faster. Not because within nature there's this mystery of hot water freezing faster. No, it's because it was a improper study, because all the variables weren't accounted for. So when you have something deemed misinformation, now you've made it so that you can't question variables, right? Like you can't even, and now you can't even talk about it, because if you talk about the variable, when you make it illegal to talk about the variable, and you make it so that somebody is going to lose their license and lose their ability to support their family, people are, some people are going to say, I can't risk not having a means of supporting my family. And other people are going to say, you know what, I can't live with this. I can't live with something being deemed misinformation when we're in a free society, and the purpose of healthcare and the purpose of medical science is to find the best treatment and that's going to cause the least amount of side effects and help the most people. And if it contradicts what was thought one day, because more data is available, because now we know the compressor is turning on, now we know the fan is blowing on the hot water, like, okay, so now we have to let the so-called authorities know that we can move beyond that because we didn't have all the data. But when we're deeming something misinformation, it doesn't allow for the advancement, and it doesn't allow for really the altruistic motive of really helping the most people, preserving life, saving life. So in a free society, we can't tolerate deeming something misinformation. What we need to be able to do is have free and open dialogue, free and open data analysis, free and open analysis of how the data was gathered, free and open analysis of what should and shouldn't be considered data. I mean, it needs to be without restraint. And if we're living in a time where misinformation is considered a public health crisis, where where your trusted medical professional is not able to speak to you freely and openly about their experiences, with treatment, with vaccines, we're done. We're done with being a free society, and to me, it's not acceptable. So each one of us, should play our part in, maintaining a free society, and making sure that, those, so-called people in power that are supposed to be working, for the people, that they know, right, we're not going to tolerate it, and that, we're gonna live in a free society. We're gonna allow for a true investigation, and really, why are we doing that? For the betterment of humanity and the health and well-being